This Keloland Living segment is sponsored by Lewis Drug, your first stop for exceptional pharmacy services.
If you've ever looked at your blood pressure numbers and wondered, what does that actually mean? You're not alone.
High blood pressure affects millions of Americans, and many don't even realize they have it.
That's why today we're being joined by Kat Ty and Orion McCartney, pharmacists from Lewis Drug.
They're here to tell us why monitoring your blood pressure matters, what those numbers really mean, and give us simple steps you can take to support your heart health every day. Thanks for being here, you two.
Thank you for having us. Yeah.
So let's talk a little bit about what blood pressure even is. Maybe you can kind of explain what we're looking at when what we're talking about blood pressure, what that means for layman's terms.
Sure. So there's two types. So there's two types of blood pressure. You have your systolic blood pressure and you have your diastolic blood pressure. So the systolic blood pressure is basically the pressure that's used to push out of the heart, and the diastolic blood pressure is the lower number, which is the blood pressure that is usually in between the heartbeats, so when your heart is relaxing.
Okay.
Okay, so high blood pressure is not good for you, right? Is low pressure also bad for you?
Yeah, they're both something you kind of want to monitor. You know, you don't want to go too high, you also don't want to go too low because they both have side effects that can happen.
Okay, so let's talk about how you check your blood pressure.
Yeah, sure. So normally when you check your blood pressure, the thing you want to do is you want to make sure that you haven't drank any coffee or any energy drinks, or you've just gone from like the gym or doing a lot of exercise. You want to kind of be relaxed. So you kind of want to have your feet on the floor kind of flat. You want to make sure that you've used the bathroom. You want to make sure that you're pretty much relaxed, and you want to get the blood pressure cuff.
Keep still.
Yeah.
No talking even.
No talking, Sometimes when I get my blood pressure, you know, they want to chat me up. I'm like, no, I know I'm not supposed to talk during the blood pressure,
I know.
right?
I have my feet flat on the ground.
Feet flat. I always have my legs crossed, and I have to remember to make sure I uncross them.
Yeah, because they won't tell you that sometimes, you know, so you really have to be the person that does it and the person who doesn't talk as well. Why do they call high blood pressure the silent killer?
So normally they call it the silent killer because it's one of those things where if you have high blood pressure for a long time, your body kind of adjusts to it and you're kind of used to it. So if you have high blood pressure for a long time, for example, it does put extra stress on your heart. It actually puts extra stress on your kidneys as well, which isn't good long term. And then there's some other side effects too, that you could end up maybe having some vision loss. It could also lead to heart problems as well as kidney problems too, like in the future. So it's something that you don't necessarily feel all the time because you get used to it, but long term it can have those side effects that we don't really want.
Right.
And is this something I can use my local pharmacist to help me with? Checking my blood pressure on a regular basis?
Yeah, we have one where you can do it yourself. You sit and put your arm in that little hole and press the button, and it also tells you what your numbers mean as well. We also have one of these cuffs as well to do on you. You prefer that as well?
Well, that's a good point. How often should a person do it? Do they need to do it every day?
Yeah, usually every day, you know, write them down into a book.
Okay.
Yeah.
And what symptoms should you look for if you have high blood pressure? If you think you might have high blood pressure, what symptoms would you get?
Yeah, if you have high blood pressure, kind of like you're kind of looking for maybe like headache, dizziness, maybe some sort of like blurry vision. Those are kind of like the signs and symptoms of kind of the high blood pressure.
So let's talk about the numbers, right? What are the kind of number ranges that you're looking for? What do those numbers mean?
So the lower numbers, normal BP or blood pressure would be 120/80. So anything lower than that. Elevated blood pressure would be 120 to 129/80. And then we go into the stages. Stage 1, which is 130 to 139 to 80 to 89. And then anything over 180 is a medical emergency.
Okay. Now, there are medications that will help this. How do they work and how do they differ? Like, what medications are there?
So there's many medications. There's kind of a few. Some of the common ones we have like amlodipine. There's some called losartan. There's some called hydrochlorothiazide. They all kind of work a little bit differently. Essentially, they all kind of try to relax. Like for example, amlodipine tries to relax like your blood vessels to kind of lower that blood pressure. Hydrochlorothiazide is what we call a diuretic medication, so that causes you to go to the bathroom or excrete kind of fluid from your body. One kind of tip that we like to say with pharmacists is that some people, when they take their blood pressure medications, is to take their blood pressure before they're supposed to take their medications. Because this would actually show your blood pressure is how it would be like, let's say you didn't take your medications at all, so it might be a little high. Let's say it's at 150.
Okay.
And then you take your blood pressure medications and maybe you wait about 30 minutes to an hour, and then all of a sudden your blood pressure comes down into like 130, maybe 120. And so for a patient, that's actually pretty good because it kind of shows how your blood pressure medications within a span of an hour can kind of lower that blood pressure, and you could kind of visually see it. And it's good for patients who maybe don't feel the symptoms of high blood pressure, but they can have a visual of numbers that they can look at.
So you might even have maybe somebody come into the pharmacy before they've taken their, or before they're picking up their medication even, and ask you for help. Just, can you get me a baseline right now? And then get their prescription filled, maybe take their medication, and just kind of hang out, maybe read a magazine in the lobby area for a little bit, and then check it again with your assistants, maybe.
Yep.
Yeah, and they can see.
Definitely.
And caffeine and alcohol both really can affect your blood pressure rating level, I mean.
Yeah, so avoiding those two would help, you know, kind of not make it go higher, will help it be more controlled too.
So alcohol also makes it increase? Okay. Why is that? Is it just because it affects kind of how you're functioning, or?
I'm not really too,
Yeah, I mean, it makes sense because it kind of slows things down, I think.
Yeah.
Right.
Are there certain medications that elderly people should take for high blood pressure over a different medication? Is it different for older people?
Yeah, there are some medications that are more preferred in elderly patients than, you know, the younger patients who do have high blood pressure, just because older patients, they tend to have more renal dysfunction, so kidney dysfunction or liver dysfunction as well, and there are certain high blood pressure medications that can affect that, so we just want to keep sure monitor those labs, you know, keep going to the doctor, making sure the medication's working for you and it's appropriate and it's not affecting any of those organs as well.
Yeah, it seems like it's one of those things where just staying on top of it is helpful, and it's easy with your help.
And taking it every day at the same time and all that
Well,
stuff.
thank you so much for being here today.
thank you.
Thank you.
Thanks.
With 61 locations across the upper Midwest, Lewis has been a trusted neighborhood pharmacy and market leader for over 80 years.
Simply head to lewisdrug.com to find the location nearest you. And while you're there, be sure to download the Lewis app to your smartphone to get special savings and chances to win Lewis app rewards.
This Keloland Living segment has been sponsored by Lewis Drug, your first stop for exceptional pharmacy services.
We'll be right back.